An underactive thyroid or hypothyroidism happens when your thyroid gland does not make enough thyroid hormone, and this can slow many body functions. It is common, but many people do not know they have it. Your thyroid is a small gland in the front of your neck. It makes hormones that help control how fast your body uses energy, keeps your heart and brain working well, and helps control body temperature. When it is underactive, your body systems slow down. This can make you feel tired, cold, and low in mood. It can also affect your weight, skin, hair, and even your heart. Now let us talk about the symptoms of an underactive thyroid and what to do. I will keep the language simple. I will use short sentences. Let us start. You wake up in the morning. You feel very tired even after a full night of sleep. You think you just need more coffee. But this tired feeling does not go away. You feel wiped out most days. You may even want to nap in the middle of the day. This kind of strong, lasting tiredness can be one of the first signs of an underactive thyroid. Many people with hypothyroidism feel slow and heavy. Your body feels like it is moving through thick mud. Your mind can feel slow too. You may say, "I'm just getting older." But this change can be more than normal aging. It can be your thyroid. Another common symptom is weight gain. You may gain weight even though you are not eating more than before. You may even be eating less, but the weight still goes up. This is because your slow thyroid can slow your metabolism. That means your body burns fewer calories. Some people gain only a few kilos. Some people gain more. Feeling cold is another sign. Everyone around you seems fine. You're the only one wearing a jumper or extra blanket. Your hands and feet may feel cold most of the time. Your body thermostat is off because thyroid hormone helps control your body temperature. When hormone levels are low, you feel the cold more easily. Your skin can change too. It can become dry and rough. You may notice flaking skin on your hands, arms, or legs. Your hair can become dry, coarse, and may fall out more than usual. Your eyebrows, especially the outer part, may thin out. You may see more hair on your brush, in the shower, or on your pillow. Constipation is another common symptom. This means it is harder to have a bowel movement. You may go less often and it may be painful. You may feel bloated. When your thyroid is low, the movement of your gut slows down. This can make constipation worse even if you drink water and eat fiber. Your mood can change as well. Many people with underactive thyroid feel low or sad. Some feel depressed. You may lose interest in things you used to enjoy. You may feel more anxious or worried. You may cry more easily. It can be hard to tell if this is just stress or depression, but a slow thyroid can be one cause of these feelings. While we are in the middle of the video, click the like button and subscribe to my channel. It is a simple help to me and courage to make more videos. Thanks. You may also notice that you cannot think as clearly as before. This is sometimes called brain fog. You may forget things. You may find it hard to focus on reading, work, or conversations. You may feel like your brain is cloudy. This can be very frustrating. You may feel like you are not yourself. Muscle weakness and joint pain can happen too. Your arms and legs may feel weak or heavy. You may find it harder to climb stairs, lift things, or exercise. You may have aches and cramps in your muscles. Your joints, like your knees or fingers, may feel stiff or sore. You may think it is only arthritis, but sometimes a slow thyroid plays a role. Your heart can be affected too. With an underactive thyroid, your pulse can become slower than usual. You may feel tired with simple tasks like walking a short distance. In some people, cholesterol levels in the blood go up. High cholesterol can increase the risk of heart problems over time. This is why it is important to get your thyroid checked if you have high cholesterol that is hard to explain. In women, periods can change too. Periods may become heavier, longer, or more painful. They may also come more often or less often. Fertility can be affected. Some women with an underactive thyroid find it harder to get pregnant. During pregnancy, untreated hypothyroidism can cause problems for both mother and baby, so it is very important to talk to a doctor if you are pregnant or trying to get pregnant and you think you may have thyroid issues. Now let us talk about how common hypothyroidism is. Around the world, it is one of the most common hormone problems. In many places, about 1 person in every 5 has some form of thyroid disease. Women are affected more often than men. For underactive thyroid, some research suggests that about 5 in every 100 people have it, but in older adults, the number can be higher. In women over 60, it may be near 10 in 100. But many people do not know they have it because symptoms can be mild at first and easy to put down to stress, age, or busy life. The risk goes up with age. It is more common after the age of 50. Women, especially after pregnancy or menopause, have higher risk. If you have a family member with thyroid disease, your risk is higher too. If you have other immune problems like type 1 diabetes or celiac disease, your risk goes up. So how do you know if you have hypothyroidism? The only way to know for sure is with a blood test. This test checks your thyroid hormones and a brain hormone called TSH that tells your thyroid how hard to work. If your thyroid is underactive, TSH is usually high because your brain is trying to push the thyroid to make more hormone. Thyroid hormone levels, usually called T4, are often low. These results help your doctor confirm the diagnosis. Now, what causes an underactive thyroid? One common cause is an immune problem called Hashimoto thyroiditis. Your immune system, which normally fights germs, mistakenly attacks your thyroid gland. Over time, this can damage the gland so it cannot make enough hormone. This is the most common cause in countries where there is enough iodine in the diet. Lack of iodine, which is a mineral, can also cause thyroid problems, especially in some parts of the world. The thyroid needs iodine to make its hormones. Some people get an underactive thyroid after surgery to remove part or all of the thyroid, or after treatment with radioactive iodine for an overactive thyroid. Certain medicines, like some drugs for heart rhythm or mental health, can also affect the thyroid.
Now, let us talk about what you can do if you think you have symptoms of an underactive thyroid. The first step is to see a doctor. Do not try to diagnose yourself. Make a list of your symptoms. Write down things like tiredness, weight changes, feeling cold, changes in mood, skin and hair changes, constipation, and any changes in your periods. Take this list with you. Ask your doctor for a blood test for your thyroid. It is a simple test. It usually only needs one small tube of blood. You do not have to do anything special to prepare unless your doctor tells you. The results can show if your thyroid is working well or not. If the test shows that your thyroid is underactive, your doctor will talk with you about treatment. The main treatment for hypothyroidism is a daily tablet of thyroid hormone. This tablet replaces the hormone your thyroid is not making. It is usually taken once a day, often in the morning, on an empty stomach with water. Your doctor will start you on a dose that fits your age, weight, and health. You will then have blood tests every few weeks or months to see if the dose is right. It can take a little time to find the best dose for you, but once your levels are steady, you usually only need checks once or twice a year. Many people start to feel better within a few weeks after starting treatment. Tiredness often improves, mood can lift, you may find it easier to think clearly again. Weight may be easier to control, your skin and hair may improve. But some symptoms can take longer to improve, especially if you had hypothyroidism for a long time before treatment. It is very important to take your thyroid tablet every day. Try to take it at the same time each day. Some people use a pill box. Some people set an alarm on their phone. Missing doses often can make your symptoms return. If you do miss a dose, ask your doctor or pharmacist what to do. Do not double up without checking. There are also some simple lifestyle steps that can support your thyroid treatment, but these do not replace medicine. They go along with it. Eating a balanced diet helps your body in many ways. Foods rich in iodine, like some seafood and iodized salt, can help, but do not take iodine supplements without advice because too much iodine can harm the thyroid. Foods with selenium and zinc, such as nuts, seeds, meat, fish, and eggs, can support general health. Vitamin B12 can be low in some people with hypothyroidism, and it is found in meat, fish, eggs, and dairy. Try to move your body most days. Even gentle movement like walking can help your energy, mood, and weight. But if you are very tired, start small. A 10-minute walk is better than nothing. Over time, you can build up as you feel stronger. Good sleep is also important. Try to keep a regular bedtime and wake time. Limit screens before bed. A calm bedtime routine helps. Some people look for natural or herbal remedies for thyroid problems, but it is very important to talk with your doctor before taking any supplements. Some products sold online may claim to boost your thyroid, but they can contain real thyroid hormones or too much iodine, which can be harmful. Some herbal products can also interfere with your thyroid tablets. Always check with a health professional. If you already take thyroid medicine, tell your doctor about all other pills you take, including vitamins. Some pills, like calcium or iron tablets, can affect how well your thyroid medicine is absorbed. Your doctor may tell you to take your thyroid pill in the morning and your other pills later in the day with a gap of a few hours between them. You may wonder if hypothyroidism can be cured. In many cases, it cannot be cured, but it can be well controlled. Think of the thyroid tablet as something your body needs each day, like glasses for your eyes. The tablet replaces what your body is missing. When you take it regularly, you can live a normal life. Most people with well-treated hypothyroidism can work, exercise, and enjoy life as usual. There are times when you should seek medical help quickly. If your tiredness becomes extreme, you feel very drowsy, confused, or have trouble breathing, or if your face and tongue become very puffy, you should seek urgent care. Very severe, untreated hypothyroidism can lead to a serious condition called a myxedema coma, which is rare but life-threatening. But with regular checks and treatment, this is very unlikely. If you are pregnant or planning a pregnancy and you have hypothyroidism, see your doctor before and during pregnancy. You may need more thyroid hormone during pregnancy because your body works harder and the baby needs thyroid hormone for growth and brain development. Your doctor will monitor your levels and adjust your dose if needed. If you live with someone who has symptoms, you can help by gently encouraging them to see a doctor. Sometimes people feel their symptoms are all in their head, but you can remind them that a simple blood test can give answers. You can offer to go with them for support. Let us quickly go over the key signs again in simple points. You may have an underactive thyroid if you notice things like feeling very tired most of the time, even after sleep, gaining weight or finding it very hard to lose weight even when you eat the same or less, feeling cold when others feel fine or needing more layers of clothes and blankets, dry skin, dry hair, hair loss, or thinning of the outer part of the eyebrows, constipation, feeling bloated, or needing to strain to pass a bowel movement, feeling sad, depressed, or anxious, and losing interest in things you used to enjoy, brain fog, poor memory, or trouble focusing, muscle weakness, cramps, or joint pain and stiffness, slower heart rate or higher cholesterol on blood tests, changes in periods, fertility problems, or problems during pregnancy. If you notice several of these symptoms for more than a few weeks, it is time to talk to your doctor. Do not ignore them. But also, don't panic. Hypothyroidism is common, and treatment usually works very well. A simple blood test can give clear answers. If the test shows your thyroid is fine, your doctor can look for other causes of your symptoms, though either way, you get closer to an answer. Your health is important. You deserve to feel as well as you can. So if you or someone you care about has these signs, take that step, book an appointment, and ask for a thyroid check. Small steps today can protect your health for many years. If you can, click the like button and subscribe to my channel. It's a simple help to me encouraged to make more videos. Thanks.